Okay. Here we are going to evaluate another question about cardiology. A 65-year-old woman comes into the emergency department complaining of leg cramps and feeling weak. She takes metronidazole for hypertension. Her blood test shows the following: sodium 134 millimole per liter, potassium 2.1 millimole per liter, urea 4.1 millimole per liter, creatinine 66 micromole per liter, and glucose 4.8 millimole per liter. What is the single most likely ECG feature to be seen? The patient has a severe hypokalemia, and we must evaluate the patient's ECG for hypokalemia. Okay, what is the single most likely ECG feature to be seen? A. U wave, B. J wave, C. Delta waves, D. Short PR interval, and E. Prolonged Q2 interval. And the choice is here because of the patient's hypokalemia. The choice will be U wave in the ECG, and we will explain why it's U wave. Okay, explanation. Muscle weakness and cramping are symptoms of low potassium levels. The potassium levels shown here are severely low enough that management is likely going to be IV replacement in an area where there is cardiac monitoring. Thiazide diuretics such as metronidazole can increase potassium loss, leading to hypokalemia, and U waves are seen in hypokalemia. The other answers are less likely. J waves are usually observed in patients suffering from hypothermia. Delta waves are seen in Wolff-Parkinson-White syndrome, and the PR interval in hypokalemia is prolonged. But here we had prolongation of QT interval. It's not QT interval, but PR interval. PR interval is not shortened, but it's prolonged in hypokalemia. QT interval remains the same in hypokalemia, although the QT interval may be falsely seen as prolonged in hypokalemia, as we have here U wave, and thus the QT interval may be falsely seen as prolonged. It's usually the U wave that is mistaken for the T wave. This is an example of a prominent U wave. A low T wave followed by a prominent U wave produces a camel hump effect. As we can see here, we have a prominent U wave and biphasic T wave, and ST segment is also depressed, and this produces a camel hump effect. And we can see clearly here also, this is called camel hump effect. Okay. As hypokalemia progresses to be more severe, the T wave decreases in amplitude and is flattened or becomes inverted. The U wave becomes more prominent. This may falsely be seen as a prolongation of the QT interval. As we can see in these ECGs, when the patient's potassium level is 3.9 milliequivalent per liter, we can see U wave in patient's ECG. But when the level of potassium decreases to the 2.7 milliequivalent per liter, we can see prominent UV and ST segment start to depress, and even the T wave start to invert. And when the level of potassium decreases to 1.3 milliequivalent per liter, we have very prominent U wave and ST segment is depressed and T wave is inverted. Okay, also we can see prolonged PR interval. Here was short PR interval, but in hypokalemia, the PR interval is prolonged, not shortened. Okay. ECG features of hypokalemia: prominent U waves, small or absent T waves, prolonged PR interval, and ST depression. We can see here also in this ECG, it's showing precordial leads. Here we have U waves. We can see U waves here, and ST segment is depressed in some of the leads. U waves and depression of ST segment, and here we can see the depression of ST segment and even inversion of T wave. Thank you for your attention.